it is very natural for us to care about our family, our kids, our parents, all of that. But at some point, we also have to ask that, is our care have a ceiling that somebody who just happens to be born within a geographic region is worthy of our care and somebody else who is not? Are we doing this as a pity, as a service to others, or are we doing this because this is what makes us human? So we really have to change it from this notion that we are doing it because we want to feel good about ourselves. That's the wrong way of doing it. You do it because this is a fundamental sort of tenet of what makes us human.
We need to be thinking much more about what makes life livable. Aid users find humanitarian response dehumanizing. The services that they receive in the field of health, when they can actually access them, are also deeply problematic and leave people feeling even more alienated and dislocated than they had. And this is counter to the principle of humanity as it's enshrined in the foundations of humanitarian response, but also like the wider sense of solidarity with people living through crisis that inspires people, broadly writ, to donate, to support humanitarian response.
In an emergency and in a protracted situation, we should not just think about what we're doing immediately, but think of the long-term goals of the development of where these populations are. And that means working with development actors, working with humanitarian actors, and of course the governments to improve a situation and thinking long-term and not short-term. And it's particularly important because of climate change and because of other areas where we're going to see more and more disruption. And one of the biggest issues that comes up consistently, and we don't have a very good solution, is the finances. So how do we pay for this? And at the beginning, maybe the international community can come in and support the local governments to be able to provide care. But in the long term, we see money going towards the crises that are either newer or in the media. And so in these protracted situations, there's less and less money going. And ultimately, it may fall on a government that also does not have a lot of money to be able to continue these services in the long run.